Hi everyone, this is Hannah Brown,
And Annie Morrill.
and our topic is bipolar disorder. So, the definition of bipolar disorder is that it is a mental illness that brings severe high and low moods and changes in sleep, energy, thinking, and behavior. So people who have bipolar disorder have periods in which they feel overly happy and energized, and other periods of feeling very sad, hopeless, and sluggish. And bipolar disorder is also known as manic depression or manic depressive illness.
There are many symptoms of the highs for bipolar. One of the symptoms is that there's excessive happiness, hopefulness, and excitement. There's also rapid speech and poor concentration, and increased energy and less need for sleep. There's also sometimes sudden changes from where you're being extremely joyful to being extremely irritable, angry, or hostile. You can also show poor judgment during the highs and also have a very short temper.
So, the symptoms of the lows for bipolar disorder are feelings of sadness, hopelessness, or worthlessness, loss of energy, not enjoying things they once liked, trouble concentrating, uncontrollable crying, trouble making decisions, needing more sleep or having insomnia, eating little or eating too much, complaining a lot, or thinking about death or suicide.
So, who develops bipolar disorder? Anyone can develop bipolar disorder. However, if they do develop it, it's usually developed in their late teen or early adult years, and the illness usually lasts a full lifetime. However, doctors do not know what causes this illness, but many things can contribute to it, such as family genes or your brain structure and brain function of the person.
So now we're going to talk about a few accommodations that teachers can make for bipolar students in their classrooms. The first one is if this symptom shows up, children with bipolar disorder find it difficult to sleep at night and wake up early in the morning. So a few accommodations that teachers can make are to schedule more challenging classes later in the day when the student is more alert for learning, or they can allow students to take tests and quizzes later in the day, or they could even allow them to start school an hour or two later.
Students who have bipolar may have poor social skills amongst their peers. So, to accommodate that, teachers can teach students proper social skills by meeting with the school counselor or the psychologist on campus. They can also teach a lesson on good social skills in the classroom to make it a more community effort. And they can also give students an aid to monitor social interactions.
So, another symptom that a bipolar student might show is that he or she can experience great irritability, sadness, and anxiety, which can result in a rage if not recognized in an appropriate and timely manner. And some accommodations that teachers can make are to have the student see a counselor, a school therapist, another teacher, or any other adult on campus when he or she feels the need to cope. The teacher could set up a private and quiet place for the student to relax, and they can encourage students to keep a journal to express his or her thoughts.
Students who have bipolar disorder may also have a hard time focusing in the classroom at school. So, to accommodate that, a teacher can provide a second set of books for the student to use at home and provide hard copies of all notes and work on class discussions and materials to use at home as well. Teachers can also extend time on testing or classwork for the student.
Students who are bipolar take medication, and so a symptom that they might show is that they have side effects due to the medication he or she is taking. So, teachers can accommodate that by allowing students unlimited access to the bathroom or water fountains, or they could allow the student to eat snacks such as crackers to calm an upset stomach.
Lastly, there's also many ways that teachers can help accommodate students inside a classroom. Teachers can get to know their students and build a strong relationship with him or her, and can reduce the classroom size itself to make it a more of a comfortable environment. They can also limit sensory input such as noise and light to help the student, and the students can sit away from noisy distractions such as pencil sharpeners or air conditioners or away from the door as well. Teachers can also turn off some of the lights to make the classroom dimmer to help the student.
In conclusion, bipolar students are very up and down, and they show a lot of different kinds of symptoms. Unfortunately, there's no cure for bipolar disorder, um, but you could get help with through medicine and therapy, and hopefully this presentation gives lots of schools and teachers tips on how to accommodate students with bipolar disorder. So thank you for watching our video.